name and date of birth. I'm going to inform them, you know, who I am, what I'm going to be doing today, which is the head to toe assessment. I'm going to go ahead and start off with my general survey, go ahead and see what I can see with my eyes as far as do I see any apparent bruising, abrasions, lesions, just that catch my eye on the whole body of what I can see of the skin. Go ahead and see if they have any discoloration or pigmentation, any cyanosis or bluing of the skin that could be a sign of respiratory distress or failure. I'm gonna go ahead and see if I smell any like offensive odors. And we will go ahead and start, I guess, looking at the skin system itself.
Okay.
We'll go ahead and, like I said, we've already inspected the skin to see if there's any discoloration or
Have we already looked at the skin, or were you just saying that was a
a
general?
general survey,
Okay.
right?
So now we're gonna get into
Yeah,
the
we're
skin.
really gonna inspect it
Okay.
to make sure, go over the entire system to make sure there's no lesions, abrasions, lacerations, excoriation, or skin breakdown. We'll go ahead and check all the bony prominences.
Such as? List the bony
Such as
prominences.
occipital area. We're going to check on the shoulders, the scapular area. Then we're going to check the elbows, the wrists. We're going to check the knees, the ankles, and the heel of the foot.
Good.
You can also check, I mean, between the fingers and between the toes. Sometimes there's a excoriation there. Let's see. We're also going to check temperature with the back of our hand to make sure it's not, you know, it's not hot, nor is it cold. We're going to check for moisture, check to see if the skin is too dry or too moist. What else? I feel like I'm forgetting something.
Turgor.
Turgor, skin turgor. Yeah. We're gonna check the skin turgor. We'll do it between the index and the thumb finger, or the thumb and the index finger.
If they've had surgery, carpal tunnel, or whatever on that right hand, what would
We
you
can do it above the clavicle right here. Most of the time you'll want to get them to roll the shoulders forward so that you can get more of that skin. But that's just checking to see if there's skin tinting, which can be a sign of dehydration.
Okay.
Usually it will go down after a while. If it doesn't go down, like I said, that can be a sign of dehydration. It might take longer in elderly patients.
Right.
And then we could go ahead and move on to nails. Check the nails. You can check to make sure that they're convex. Make sure there's no like debris or abrasion around the cuticle areas. We can also check capillary refill. Make sure there's no clubbing.
If you check capillary refill, what's the scaling?
1 to 3 seconds. Usually it's under 2 seconds, no more than 3 seconds. And you're going to check it by putting adequate pressure on the nail and then releasing.
So for validation, what are you going to just check one fingernail and be done?
No, you're going to check one finger of each hand bilaterally on the upper and lower extremities.
Okay, good.
And then
What is he missing? Anybody
am I missing anything?
interject? Those that may have a sheet or something, or
I've checked in bony prominences, and then
Yeah.
I was actually about to say that you can do the what's it called, the Shamrock test to check for clubbing in the fingers. It's basically where you get them to
did she go over that a
both their
lot?
index-
No.
But she didn't. I don't know if
She
it's her
just told us that it was just shamrock.
Oh,
But
no.
I mean, I don't think it's
Right.
So anyway, the nails you can also check for like striations, check the thickness.
Okay,
But I think you got it wrong.
that's good. Yeah.
Do you say like cleanliness under the nail?
Yeah, cleanliness, no debris or anything like that, no abrasions around the cuticle.
Yeah, I mean, he just did that. You can do this.
So,
Edena's what
so
you're
we've
missing on
done
the
the
skin.
skin and the nails, so we'll go ahead and move to the hair on top of the head as well as throughout the body, because hair is also throughout the body. So we're going to go ahead and check the cleanliness of the hair, make sure they have good hygiene. We're going to check to see if it's dry or brittle. We're going to check for moisture in the hair. We can also comb the scalp to see if there's any kind of visible infestation. We'll go ahead and check the rest of the body as well to make sure that there's no apparent hair loss or alopecia. Let's see. And then we can move on, after we've checked the hair, we can move on to the head, check that the contouring of the head is normocephalic, meaning that there's only prominences in the occipital and the frontal regions. We make sure while we're inspecting it that we don't see any lesions or abrasions or lacerations. And then we can palpate the head to as well check the contouring, make sure there's no out of place masses or anything like that. Make sure there's no tenderness. And then we can move on to the facial part of the head. Make sure that all facial features are symmetrical. Make sure that nothing is visibly, asymmetrical or out of place, like facial drooping, which could be indicative of a stroke. Let's see. Make sure that all of like the facial bone structures are symmetrical as well. I think that's pretty much it as far as the face goes. We can move on to, I guess, the ears. So we're just gonna check the ears for any signs of drainage. I'm gonna wait to do all the cranial nerves once I get through.
What's our time frame for
30 minutes.
30 minutes? Okay.
Sorry, am I going?
No,
too
no, I was
fast?
just, I was just reminding you. Just,
Okay.
right. Yeah.
Okay, I'm sorry.
No, no, no. No pressure
So,
there.
checking the ears, make sure there's no fluid or drainage. Make sure that there's no abrasions or anything like that. We can move on to the nose. We'll check.
Is there any hearing tests when you're doing
Right,
ears?
that's with the vestibular
Okay.
cochlear, which is a
Okay.
cranial nerve,
Okay.
and I'll do that at the end
Okay.
before I get to the
I
rest
know
of
you
the
just
body.
said that. That's right.
So, we'll go to the nose. We'll go ahead and check the nasal mucosa, make sure that it's moist and no redness. It's pink and moist. Make sure there's no deviation of the septum. Make sure there's no obstruction of the nares. Make sure that the nostrils of the nares and the nose the nares are symmetrical, and the nose is basically midline. We can check the mouth. We'll check the buccal mucosa to make sure that there's no redness, no ulcers, no lacerations or abrasions. We'll check the gum line for bleeding or discoloration. That it's not there's no pallor, but it's also not red. You can check for abscesses. You can check intention. And then you can check the tongue to make sure that there's no for bacteria. While you're doing that, you can check to see if they have halitosis or bad breath, which can be indicative of a lot of things. Let's see. Check the throat. Make sure that the uvula is midline. You can check the tonsils to make sure that they're not inflamed or they're not kissing, touching each other. I don't know if she goes over that, but that's just something from my experience. So,
I don't think that's in it, because not everybody has tonsils.
all right.
They wouldn't be kissing.
Right. Make sure that the throat's not red, it's pink and moist back there, no dryness.
On the uvula, how did you check? Are you gonna wait for the cranial nerve for that?
Mhm.
Oh my god.
I did check to make sure the uvula was midline and that it was
Right.
present.
Okay, good.
It's a little more organized than me.
So I think that's pretty much as far as like
Anything that
as far
he's
as
forgetting so far,
inspection,
y'all with sheets?
other than like the cranial nerves.
Okay.
So I guess we'll go to the cranial nerves.
What?
Yeah. Well,
No, that's
well I
good.
mean, it makes sense
Oh,
once
that's
you're
fine.
done
I
with
was
the
just kidding.
head
Yes, right.
to just go ahead and get that out of the
Sure.
way.
Missed the pre-pose.
The 7 lymph
Lymph
nodes.
Oh, I
nodes.
did. I missed.
I didn't know if that's coming after the cranial nerve.
No. So the lymph nodes. So we've got the preauricular.
Where's the
Alright.
preauricular?
The preauricular is right here.
Isn't it more here?
It's like right here.
Like right there.
You were doing cheek.
Oh well.
It's in the
Sorry,
soft
Colton.
spot before the ear.
It's
I
probably
just
'cause
want,
was
I want
using my
correct
top.
placement.
Okay. So right here,
Yes.
and then postauricular.
Mm-hmm.
Okay, and then you've got your occipital.
Good.
You've got your submandibular,
Yes, sir.
your submental,
Okay.
your deep,
Cervical chain.
See cervical.
deep cervical chain, and then it's the supraclavicular.
Oh, oh that's right. Mm-hmm. Very good.
All right, so we checked all those lymph nodes to make sure that there's no, they shouldn't be easily or palpable at all unless you've got a very like emaciated or skinny patient. You usually won't feel them. If you do, that would be a finding. If they're swollen, if they're tender to the touch. But we checked the lymph nodes. Let's see. Did I miss anything else?
No, you're good.
Okay, so cranial nerves. We'll start with cranial nerve 1, which will be olfactory. And we'll do that by checking their sense of smell. If we had already walked in and we saw that they were, they were eating or doing something of that nature, or they made a comment about a smell or an odor, we could go ahead and check that off. If not, we could use an alcohol swab, ask the patient to close their eyes. We could hold it about 5 inches away from their face. Ask them to identify the smell. That would be a way to check if the cranial nerve is attacked. The second cranial nerve would be the optic, and that's checking for visual acuity. So we can use we can use either a Snellen chart, or if we do not have a Snellen chart, we can ask the patient to read something farsighted or read something far away, like maybe their chart or the dry erase board in their room. Ask them to read something off of it, and then if they have a newspaper or some kind of papers, we can ask them to read it nearsighted, or to check for nearsightedness. Let's see. 3. Oh God, I'm gonna get caught up on the nerves.
On old Olympus.
So it's olfactory, optic, oculomotor. Sorry.
And 3 goes with what?
3 goes with 4 and 6. So 3 is oculomotor, then we got trochlear, and then abducens. And they're all going to check for extraocular movement. So
You got fancy.
Speak
with
up if I miss
Right?
it.
You got. I was like eye movement, but you got fancy with the word. I was like, I'll shut up now.
EOMs, it was on that little thing.
Yeah, it's your
Yeah,
eye
yeah.
movement and your it's the asterisk pattern.
So we can check extraocular movement, excuse me, by doing the 6 cardinal fields of gaze. We can use that. Where did my pen light go? We can do that by taking our pen light, ask the patient to focus on our pen light, and keep their head still and only move their eyes and follow our pen light, or our fingers. Use your finger as well.
So when y'all do this in the hospital, you gotta turn off the patient's lights in the room, close the blinds. Just don't think you can go in there and do it with a bunch of lights on, especially for dilatation and constriction.
So we'll do the 6 cardinal fields of gaze.
If she hasn't taught y'all that, don't learn it from me. Just do the asterisk.
But what did you call it? 6 cardinal fields.
Gaze.
Fields of gaze.
G-A-Z-E.
Okay, so we check the 6 cardinal fields of gaze.
Good.
and I think that's the only test that you do for the extra.
What's the one that you?
Or UM, right? Huh?
No, what's the one that you hold it like and then you bring it in?
Convergent.
That's
conver-
convergent,
right.
and that's for accommodation. That's a pupillary reaction test.
Right.
That's
I didn't know if you was gonna do it then or.
No, because that's a different. Is that also in those 3 nerves? I thought that was in a different.
Okay.
It's not in the nurse.
It's just in the
Oh,
eye
oh,
exam.
yeah, that's in the. Wait. I didn't do
You
You
that.
didn't
didn't
do
do
the
eyes,
eye.
no.
I thought that would be considered a part of a nerve. Though.
There's
Maybe
one
it's
test.
not.
Perlo usually is in the eye exam.
Well, I mean, I know that.
Okay, but just
I just thought that the convergence test was a part of. Maybe
You
maybe
just
I
throw it in anyway.
Okay. Anyway.
Just so long as you do
And
it
then
right.
accommodation.
Yeah,
Okay. So.
The last one is combination.
Going back to the eyes, I think. Wait, I already checked the conjunctiva, the sclera, and all of that.
I didn't hear that.
I didn't hear
I thought
none
that
of
I
it.
did that.
Uh-uh.
I
We
thought
just-
that
You
I
did it in
that.
your
My
head.
bad.
And how many
I did it in
minutes
my
are we
head,
into
yes.
it now?
15.
Okay.
15. Going on 16.
So, going back to the eyes, we're going to check for perla, which means pupils are equal, round, and reactive to light accommodation. We'll do that by doing indirect and direct. What light? What is it called? Indirect and direct light.
Indirect and direct light.
Yeah, there's like
Pupillary response.
pupillary. Okay, we'll call it that.
I think that's what it said.
Indirect and direct. Like pupillary response. Okay, so you're just going to shine a light or your pin light into one of their eyes to make sure that the pupil dilate or constricts. I'm
Constricts.
sorry, and the other eye, even though you're not directly shining the light into their eye, should have the same response as far as constriction goes. And you can do it in the other to make sure that direct and indirect response are going to happen in that eye as well. You can also do the convergence test, which is you take your pin light and ask them to focus on your pin light and follow it as it moves. You move it inward to the tip of their nose to make sure that the pupils constrict the closer it moves in. And then as well, you will ask the patient to focus on something far away to make sure that the pupils dilate when they focus far away.
Do y'all agree to that?
Far away, it should.
They should,
It should. No.
It should
no, dilate. Yeah, they go in.
The
So they
pupils will
shrink.
dilate.
Yeah.
I thought when
To
someone
When you bring it in, I thought the eyes supposed to go.
At far distance, your eyes are going to constrict because you're trying to focus in on that. Closer, it's
Oh yeah,
gonna-
that's right.
they're gonna open
Dilate
up.
far away
I
because it's
thought,
far away.
I thought that they would
constrict as close.
dilate when
Right?
you're.
Light. I mean, the light from the pen, you come in and it'll go, okay, like if you have it like this, and the room's dark, and they look,
It'll get constrict.
it'll constrict.
Yeah.
Right.
Those
I
with
was
cataracts
talking
will
about-
not. It'll stay fixed and
But when
and
you
constrict.
do convergence, as far as
Well,
like
the convergence,
Convergence.
you're basically just checking to see
we're
if
not
both
checking
eyes
for
will move.
dilatation and constriction on
I-
convergence. I didn't think
But you're
that.
basically looking for a lazy eye with convergence.
Right,
I mean, I know that, so it's
uh,
extra. Okay, I'm sorry.
Stick-
Instructors
You're
are
thinking
telling me
about
a
the
million different things.
focusing on
Well,
something
no,
distant
it's
and
just that
short.
like I've heard a million different things from
Final
a
one,
million
whoever
different
did get
instructors.
one.
Oh, that's fine.
So my thing is, if you look at an object far away, your pupils should dilate. Typically, right? Or when you look at an object close, it would
It depends on the lighting in the room. They don't get hung up on
I
that.
thought that it was.
Heard from 12 different instructors, different things.
Oh gosh, okay. Well, I'll be right. What is
I
it?
She's right.
Is what it, okay? So the convergence test. What is that checking for? Is it extra ocular or ocular movement, or is it checking for pupil constriction?
No, it's not checking for pupil constriction. So it's part of how your pupils can accommodate in certain situations. So the convergence, the one where you do the 12 inches and bring. So it's eye movement. It's the muscles. So if one moves and the other one doesn't, it could be a problem with the nerve that controls the movement of that particular eye.
So don't think
So that-
dilatation and constriction.
So you can include, can you include that test in the cranial nerves? Would that be considered a part of the cranial
Some
nerve?
people do, but it's really not.
Okay, so I
It's
should
really
just
not.
include
So,
that when I do the
well, okay, the 3, 4, and 6. It's the
That's
one that did the
6
asterisk.
cardinal field
A lot of people will do Perla, you know, when they're right there, they're doing all that together, so they think Perla's really Perla's a whole thing on its own.
So
And
you
that
don't-
falls under accommodation.
The convergence test, that's the only thing we have to do for accommodation? Can we
And
also
what
do
else?
The part where they
What I was talking to you about, the far
Okay.
object and
looking
the
far
close.
away?
Okay, so accommodation, so your Perla, and then the pupils, you look at the size, not when they're constricted or dilated. You're looking at them at rest. That's when you should size your pupils.